Welcome to the trenches. Today's topic is sepsis. Quick talk on sepsis. Thing is, you got to recognize this early. Okay, sepsis is the immune response to the infection. You do not need bacteremia. You do not need positive blood cultures to be septic. Let's go through some history. The original criteria when they started having critical care society meetings around 1990 discussing this were SIRS criteria plus source of infection. Now this has changed. A little, but let's go over this. So SIRS criteria is heart rate greater than 90, respiration greater than 20, white count either greater than 12,000, less than 4,000, or greater than 10% bands, an elevated temp, or a decreased temp. Think elevated temp greater than 38 or less than 36. You needed 2 out of 4 of these plus a source of infection. And you look initially the usual sources, the urine, the lungs, the hepatobiliary system. What they found with this was too many people in this category. You can have a virus and you can have an increased heart rate and increased respiratory rate and a fever. So too many people were going in this spot. But initially that was sepsis. Severe sepsis was when you had an organ system involved related to sepsis. So you could have had ARDS, shock liver, AKI, low platelet count, or DIC, change your medical status, and then you had septic shock. And there, the blood pressure was low. That was sepsis 1. Sepsis 2 was kind of complicated. And they had with sepsis 2 a list of things to use the Apache criteria, but basically the most recent guidelines for sepsis define sepsis, okay, as an infection, and then you have one organ system